So fibromyalgia is actually the most common condition rheumatologists see. Fibromyalgia is a chronic musculoskeletal condition that causes chronic pain and fatigue. Patients often feel unrefreshed in the morning. It's important when you evaluate patients for fibromyalgia that you rule out other conditions that could possibly exacerbate the symptoms. For example, when I see a patient who I feel might have fibromyalgia, I question them as to whether or not they may have sleep apnea. Do they snore at night? I make sure I check their thyroid function test. I look for other conditions that can mimic fibromyalgia, such as Sjogren's syndrome. Sjogren's syndrome is a relatively underdiagnosed condition associated with dry eyes and dry mouth, but it can also cause severe fatigue and achiness. There are specific findings that you might see in a patient with fibromyalgia. One of the hallmarks is finding tender points in all four quadrants of the body. And I like to use that as a diagnostic tool when I examine patients. So four quadrant means that they have pain in the left and right side of their body, as well as above the waist and below the waist. Or some doctors don't believe in the diagnosis because there's no specific blood test or histological abnormality. I find when I treat them in a certain way, many of them will get better. Nobody really knows what causes fibromyalgia. There's some genetics involved, environment plays a role, and patients can have fibromyalgia at a very early age. So if you feel like you hurt all over, you're tired, you may have sensitivities to noise or light, you may have irritable bowel symptoms, and you don't feel refreshed in the morning, you very well may have fibromyalgia. The good thing to know about fibromyalgia, it doesn't damage the joints. There's no reason that patients can't have a good quality of life, even if they have fibromyalgia. When you treat fibromyalgia, the first thing you want to do is go over the conservative treatments, and these include trying to improve the quality of your sleep, making sure that they get into some sort of exercise program. This could be Tai Chi or yoga, low impact aerobic exercise, but that's very important in fibromyalgia. It's also important that they pace themselves. Many patients with fibromyalgia will feel good one day, so they tend to try to overdo, and that makes them feel worse and they get into a flare. So they need to learn to pace themselves. Sometimes we can put patients on a medication if that's the treatment choice, and they start feeling better within a month or two. Sometimes it takes longer to find the right treatment. I ask them to be patient, as it may take several months or even a year to try to find the best treatment for them.